Hello, I'm Michael Posey, the editor of Pharmacy Today with the American Pharmacists Association. Today I'm here with Brian Gallagher, Senior Vice President of Government Affairs with APHA. We want to fill you in on Healthcare Reform 101. So Brian, for people who haven't been watching the news the past couple of years, how would you describe the new healthcare reform law?
Well, I brought a copy of it with me here. This is it. It's about 2,000 pages long. If you got insomnia, this is the cure for it. But it's, in all seriousness, it's about 2/3 to 3/4 insurance reform. So that's one big portion of the bill. The second portion of it is testing innovation. And what Congress was trying to do with the testing of the innovation was to test concepts, models, and ideas, see what works the best, and then fund the things that work the best. So to get improved health care for everyone.
What were some of the major goals that Congress was trying to achieve when they passed healthcare reform?
Well, the first thing they realized is that you couldn't do it in Washington. Healthcare ideas are not going to come out of Washington. So what they wanted to do was look out across the country, see what innovators were doing with regard to healthcare, take those ideas, test them, as I talked about, and then fund the things that work the best. So what they're trying to do is, or Congress makes things sometimes more complicated than it needs to be. Sometimes people look at healthcare in a way that's more complicated than it sometimes is. And what they basically wanted to do was only two things, which is see what increases access and quality and what decreases cost. Now, those two things in a lot of ways are seemingly mutually exclusive. So the question becomes, how do you do both of those things at the same time? Well, one way you can do that is by using the most underutilized brain power and the most accessible healthcare professional in the system, the pharmacist. So you can increase access and quality and decrease costs by more fully utilizing pharmacists.
During the debate over healthcare reform, there was a lot of opposition to the bill, and there remains a lot of opposition to the concept now that it's a law. How has APHA been able to balance the fact that members are on both sides of this debate?
Very true. APHA, a lot of members, a lot of people on all sides of this question. So APHA didn't take an official position on the bill, so we didn't support it, we didn't oppose it. However, there are a lot of pharmacy-friendly provisions in the law, and so APHA went forward to try to make the most of those pharmacy-friendly provisions to get them as beneficial to us as we could possibly make them. So if and when the bill passed, those would be in place for pharmacy to be able to take full advantage of them. It's really a golden opportunity for the profession.
And what is the rest of pharmacy thinking about healthcare reform? What are the other organizations saying and doing?
Well, this is a great story because as a result of healthcare reform and because this bill is so big, pharmacy pulled together, APHA took the leadership role in pulling pharmacy together at a national level. So we formed what's called the Pharmacy Stakeholders, which is composed of 15 national pharmacy groups. And so we're working together. So when we go to Congress, we're making joint visits and we're delivering a joint message so that pharmacy is all unified. But the idea being that no matter who gets the credit for this, if we advance things like MTM and other pharmacist clinical services, all boats will rise with the tide. So pharmacy is really united in this.
And during the debate over healthcare reform, APHA was very successful in mobilizing its members and other pharmacists to contact Congress and support the pharmacy-friendly provisions that you talked about. Now that we're in the implementation phase and the action has shifted to the Centers for Medicare and Medicaid Services and other parts of the bureaucracy, what does APHA need people to do?
Membership is critical. Membership in APHA, membership in state associations, absolutely critical because we've got 200,000 to 2 million pages of regulations coming out of this. We need pharmacists in the communities to be delivering the message and to be understanding what the message is. And APHA can take the lead in that, but we can't be in every community. So our members need to do that, and it's a golden opportunity. So if they utilize our resources on the website, they can take the lead, be leaders in their community, and it all begins with APHA membership.
Oh, very good. Well, thanks for joining us today, Brian, and filling us in on Healthcare Reform 101.
My pleasure. Thank you.
Be sure to watch other videos in this series available on pharmacist.com in the Healthcare Reform section. Thank you for joining us today.